Ladies and gentlemen, we'll be treating a number of wounded here today. We already have this patient up on the table. We're going to be doing a leg amputation on this particular patient. So we'll be starting in a minute. We're also expecting more wounded to be coming in as well. When those wounded come in, what will happen is that our triage nurse will be taking a look at them and being able to tell us which ones we want to treat first when we're ready to start treating them. Now again, for this patient here.
Think, O Lord, of this soldier who has performed his duty and is wounded. I commit him to your compassionate care. I implore you to heal his wounds, renew his spirit, and return his strength so he can continue to serve you in this noble cause. Thy will be done. Amen.
Amen.
In nomine Patris et Filii et Spiritus Sancti.
This patient has already had a tourniquet put on his leg. We're giving him gas anesthesia. After we do that, we'll also be giving the patient an IV. Now our team over here consists of Pete, who's a United States Army Major Surgeon, also assisted by what's known as a nurse anesthetist. That's the one that just gave the anesthesia there. Also assisted by a scrub nurse who has the duty of assisting the anesthesiologist and passing instruments over, and also assisted by what's known as a close-in surgical nurse who will actually be helping the doctor with the amputation. So the patient has had an IV installed, he's had the tourniquet installed, he's had gas installed. We're just checking now if he's got enough anesthesia to be able to do this operation without excessive amount of pain. How's he sounding?
Good.
Ready to
Stable.
go?
He's ready.
Okay. Doctor, you ready to perform?
Ready.
All right.
Scalpel and retractor.
So he'll need a amputation knife. The amputation knife is used to cut the skin back. We always do this in a very delicate and methodical manner. What we want to do is be able to save as much of that skin as possible to be able to then make a flap over the bones, and that way there's a surface to work with to be able to put on an artificial limb later. So we cut through the skin. The nurse is holding a grand retractor. This is actually holding the skin out of the way. Now at this point there are also blood vessels that are bleeding, so sometimes what we do is we use forceps to clamp those blood vessels to reduce the amount of blood that's coming out. And you can hear the sawing that's going on here. Meanwhile, the nurse anesthetist is continuing to check the vitals to make sure everything is good there. The other nurses are holding the limb down. Do you need some forceps or blood vessels, surgeon? Yeah. All right. We'll go ahead and put some in there. Are you cut through all the way?
Yep.
Okay. So what happens is that we've cut the bone through all the way. We're going to remove the amputated foot. Okay. Chaplain, hold that up so people can see it. So we've actually taken the foot off of the individual here. We'll just kind of set that aside. And now what's happening is that we are dressing this wound to be able to stop the bleeding, and then we'll continue to monitor the patient's vitals.
Damn short of a machine gun.
While this surgeon is wrapping up the care on this patient, we'll be working on the other patients as they come in.
How was school?